With all of these cuts to Medicare, $464 billion in this proposal, $192 billion in reductions to most services, $118 billion in cuts to Medicare Advantage, $21 billion in cuts to hospitals serving low-income patients, $23 billion from other sources. It seems inevitable that seniors are going to have a lower quality of health care. What really is disconcerting about the path that it seems that we're on is that we're going to have this government-run health care system, and if already now people can't go see their doctor if they're on Medicaid because doctors won't take Medicaid, and if it's growing more and more the case that you can't see a doctor if you're on Medicare, and I have some information here about 29% of beneficiaries surveyed saying they're having a problem finding a doctor who will take Medicare. And there's a gentleman from Florida, from Sanford, Florida, Earl Bean, who was interviewed this week, and he said, I called about 15 doctors and was told repeatedly that they were not accepting Medicare patients. They wouldn't even take his name when he called up. So what I'm worried about is that we're going to enter into a system where 5 years from now, 10 years from now, when everybody in the country is basically on a government-run health care program through Medicare, Medicaid, or this new program, which unfortunately we all think will push the private insurers out of the business eventually, and we'll all have government health care, is we're going to be going places, there'll be 100 people waiting in the room, if we can get a doctor at all. They'll be rationing the care. They won't be providing mammograms, like this recommendation came out this week from the government task force for women in their 40s, be discouraging self-breast exams for women, and we'll all have very poor quality health care unless you're wealthy. If we enter on this path, is we're going to go to a world where the vast majority of Americans are going to have poor quality, government-run health care, and only the very rich will have access to good doctors and all the best quality of health care. And that just doesn't seem to me like an America we want to live in.